Every day, people ignore the number one hidden sign of a heart attack, thinking it is something minor like stress, a heavy meal, or a flu. But this one symptom, it could mean your heart is in immediate danger. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the number one heart attack sign people ignore, and it could save your life. Heart attacks sometimes could present in an unusual way. And the worst part, it doesn't hurt, it just whispers, so you don't understand it. So heart attacks can present in unusual ways, and it will not raise any red flags. So what exactly is a heart attack? A heart attack happens when the blood flow to your heart is blocked. If you look at this blood vessel, that's the normal blood vessel. Very good flow of blood. Then we have that blood vessel almost completely blocked. So when this process happens to any of the arteries supplying the heart, the part beyond the blockage has no blood supply, and that is what we call a heart attack. So blood has been cut off. We imagine this could be dramatic, with the chest clashing and collapsing to the ground. But here is the shocking truth. Nearly 1 in 5 heart attacks is silent. No clashing chest pain, no dramatic warning. Instead, your body sends subtle distress signals, and these you often ignore. That's why today I want to reveal some of these signs that you commonly ignore, and they could mean a heart attack. According to the American Heart Association, one of the most commonly overlooked signs is a cold sweat, or feeling nauseated, or feeling lightheadedness, or like that feeling of indigestion. And this is without any chest pain. You may think it probably just I ate something wrong, and I've seen this in a number of patients. But it could be your heart that is starving for oxygen. These symptoms, especially when unexplained and sudden, are often first signs of a heart attack, and most people will ignore them. Why do many people ignore them? They mimic common issues: indigestion, anxiety, or even the normal fatigue. There is no chest pain. When you have pain, it calls for immediate attention. So if there is no pain, we assume it is nothing serious. Women, older adults, and people with diabetes are more likely to feel subtle symptoms like nausea or arm or back discomfort, not the chest pain. In one of my previous videos, I've talked about a presentation of heart attacks in women. You could take this opportunity to have a look at that video and watch it to the end to understand how heart attacks present in females. One woman shared how she felt. She was a bit off For a few days, she was feeling tired. She was feeling sick to her stomach, and she had cold sweats. She thought it was stress. The next morning, she had a full-blown heart attack. She survived, but barely. Others aren't that lucky. So if you notice these symptoms, what is the wise thing to do? If you or someone you love experiences any of these unexplained symptoms, cold sweats, nausea or indigestion, sudden fatigue, shortness of breath, dizziness, or jaw or back discomfort, call the emergency services immediately and go to the hospital. Don't drive yourself. Don't wait or see if it goes away. Early treatment can save your heart and your life. And this is especially so if you are over 40, you have diabetes, or you have hypertension, or you are overweight. Prevention is very powerful. Control your blood pressure. Eat healthy foods rich in fruits and green leafy vegetables and whole grain carbohydrates. Exercise regularly, between 150 to 300 minutes of moderate intensity to high intensity aerobics. Manage stress and know the signs. Awareness is not just for information, but it is protection. Share this video. It could save a life. Subscribe for more health saving tips in the Overall Health YouTube channel. If you have weight issues, subscribe to the Health Insight 360 to help you manage diabetes and also obesity with lifestyle changes. Comment on the comment section of this video so that we know what has been your experiences with hypertension, diabetes, and even obesity, and what are some of the challenges that you have been having managing them. Thank you for watching. Share this within your circles